Welcome back to the World Cancer Day Facebook Live. Now we have a session on a specific event that happened a few hours ago on intergenerational dialogue between two generations of cancer survivors. We have the pleasure to have with us Maria Fatima Garcia-Lorenzo, who is the co-founder and the executive director of the Kite Foundation. And Fatima is a certified child life specialist as well as a psychologist. She has been caring for children with cancer as well as with other chronic diseases for about 30 years. As also the Kite Foundation just celebrated 2 days ago its 30th anniversary. Welcome, Fatima.
Thank you for having me, Melanie. It's nice to be here.
Thank you so much. So my first question would be about the Kite Foundation. And if you could please tell us more about how the Kite Foundation, through its support to children with cancer and survivors, is really making a difference to close the care gap.
Okay, thank you, Melanie. First, the meaning of kite. Kite is derived from a Scottish word, which means to manifest oneself through simple sharing and togetherness. And we have a flagship program called Child Life Services, and we provide psychosocial support to children and their families in 11 partner hospitals nationwide. And we also have a family support program wherein we are able to provide financial and medical support to children with cancer and chronic illness. So we serve about 8,000 in a year, and both for psychosocial. And we have adopted patients, we call them adopted patients, wherein we provide full financial support to children who are in need of help, of financial help, especially for medicines, transportation. Would you believe even water? We even provide money so that they can buy clean water when they go for treatment. So it's a whole package so that they will be able to have a greater chance to survive cancer.
Thank you so much, Fatima. And really the work of Kite Foundation is truly impressive in the sense that it's comprehensive. Closer Care Gap is all about social determinants of health, and through psychosocial support, but also the comprehensive support that you're offering to children with cancer and their caregivers is truly important. And as an illustration, so as you know, the first year of this new campaign for World Cancer Day on Closer Care Gap is all about realizing the problem, really reflecting on the different gaps, but also opportunities to tackle inequities in our context. So I think the webinar you held today on the discussion, the conversation between the two generations of cancer survivors is truly really a great occasion to reflect on what are the gaps, but also the opportunities to share hope. Can you please tell us a bit more about the conversation that happened this morning?
Yes, I'd like to give you the highlights. So it was a webinar for 2 hours, and we had 2 sets of speakers. We had a advanced advance of age of cancer survivors and the young cancer survivors. And you know what was striking about the conversation was, first, what was common. I'm going to talk about first what was common among them. What made them survive was their will to live, their positive thinking, their faith in God, and family support. But also what was striking was Miss Malu and Sir Edwin, they were able to access treatment, diagnosis, medicines right away, whereas our younger survivors had to strive really line up to get financial help, line up, and even at first they were not even diagnosed right away. They had to go from one hospital to another to get their proper diagnosis. So you could see the disparity between the inequity really of the health system, of the haves and the have-nots. And this has to change. Regardless of age, regardless of socioeconomic status, everyone should have access to proper diagnosis, treatment, medicine, information. The fact that information, one of our survivors said that he did not know what cancer was about. That's why it caused him fear, greater fear, and it held back even for compliance. So these gaps have to be addressed. And on our end with Kythe, this is what we're trying to address with our child life services and our family support program. And also on a larger scale, we're also supporting the coalition of cancer support groups so that we're pushing Congress, we're pushing DOH and PhilHealth, our insurance company, to provide really the needs, to provide for the needs of our cancer patients.
Wonderful. Thank you so much. I guess it was a really interesting conversation. It's also an occasion to build collective experience between cancer survivors. Did you have any other highlights about the testimonies, for example, between like older generations could share their experience about their personal, professional lives with younger generations of cancer survivors? Did you have like any testimony that's hope in this dialogue?
Yes, actually what was different was for the adult survivors, you know, they were able to express themselves right away. They were able to ask their doctors for information. They were very straightforward and open. Whereas our younger cancer survivors, they had a hard time talking to the medical team. They had a hard time talking to their doctors because sometimes they think that if you are young, you do not have a voice. And again, that is what we can put forth, that if you are a cancer patient, you must have a voice.
Totally. Thank you so much, Fatima, for this really inspirational aspect, because we can see that this dialogue can inspire and give confidence to younger generations of patients and survivors, but also their caregivers. And it's really a wonderful light of hope for cancer patients and survivors. And as a motto of Kite Foundation is really the hope, and how we can give hope to each other, but hope to change the system also, and to change, as you said, to close a care gap, and on the gaps we can still see today, and even compared to yesterday. And what are your hopes to change, to make a difference for people living in cancer in the Philippines? You already mentioned like the efforts of the DOH. Do you have any other hopes for the future?
Yes, young or old, as a collective voice, we're able and we should really push, advocate really for more funding for cancer patients in the Philippines. And then because of the National Integrated Cancer Control Act, we need to really encourage the health leaders to implement the law, because it's such a beautiful law. And it covers all ages, all cancer types. So if they're just be able to implement it and really follow what is in the law, I think we will have more survivors in the Philippines. And also add more funding. It's essential. That is the key, because you may have a beautiful law, but if there is no funding to support the implementation of the law, then everything, it will not move forward.
Thank you so much, Fatima. And indeed, health financing is really at the core, and just to have the means to implement the NICA and such powerful laws. So thank you so much, and it will like change the life of cancer patients, their caregivers, and survivors.